The need for innovation in healthcare has never been greater. As hospitals navigate the multitude of daily economic and operational challenges, they are particularly interested in exploring new solutions that allow them to improve outcomes for patients while lowering the cost of care. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, Senior Writer for the AHA. At the 2019 AHA Leadership Summit, the AHA Center for Health Innovation hosted a startup competition featuring 6 early-stage companies that have all developed practical, tactical innovations. Finalists were chosen based on how well their proposal aligned with one or more focus areas. These included affordability, high-value healthcare, population health, performance improvement, and new care delivery models. In this podcast, Mital Patel, Director of Market Intelligence for the AHA Center for Health Innovation, speaks with Chris Looby, Vice President of Business Development for Prescience Health, one of the 6 finalists chosen for the competition.
Good day, everyone. My name is Mital Patel. I'm the Senior Director of Market Intelligence at the American Hospital Association's Center for Health Innovation. I am joined here today by Chris Looby, who is one of the original founders and the VP of Business Development at Prescience Health. Chris, welcome.
Well, thank you.
Let's get right into it. Chris, why are you here at this annual summit this year? What was your motivation to attend?
Well, we got word that there was a competition for startup companies that can improve the operational performance of healthcare provider organizations. And we were excited right away when we heard that, and we applied. And then we got the word that we were asked to come and actually compete. And here we are. We were absolutely delighted that we had that opportunity.
Great to hear. So as a leader of a startup company, there's no shortage of work to do. And so I'm sure you have plenty of these opportunities to do these competitions. So why did you choose the American Hospital Association's competition to put forth the energy and apply?
The thing that was really exciting is the focus on innovation and performance improvement, trying to really change the way that work is done in healthcare systems and organizations and providing care. And this is different than other competitions where you're just, say, competing for dollars, because you're making pitches, because, of course, the company has to be funded as a startup. But this is the opportunity to get with organizations that are actually doing things and hear from the customer. Present it to the customer, but hear from the customer and get some feedback and validation. So that was a key motivation. Literally, there's some of the key words that were in just the materials that the AHA has put out on this particular year's event: innovation, operational performance, and improvement and change. So those were all things that resonated with us.
Great. Yeah. Let's dig a little deeper there. So two-part question. One is, what were some key learnings for you and your team as you were preparing for the competition? And then key learnings during the pitch and after the pitch?
That's a really interesting question and a good one. So we'll just take an example of the creating a pitch deck. The first one that was put together and sent off to the folks putting this together seemed concise and straightforward and pretty good. Then it came back, suggestions for change. Slim it down. Make it sharper. Include this for more punch. And so after 5 iterations, I think it was,
wow,
back and forth, what was really great to start with was really, and what we ended up as the presentation was really so sharply focused. So the assistance there has been fabulous to really take something that we've worked with, because we've been at this a while, done a number of pitches, but really honed it down to the essence. And it clearly resonated with people in the audience yesterday. So that's been a fabulous assistance to us. And then afterward, just hearing from the users, mm-hmm. people who, heads of organizations, they're thinking about these things, and they come up and said, wow, that's something we didn't know was there and available, and we'd like to know more.
Great to hear. And then, thinking about just the interest and the engagement that you got from the members here, what is it about your value proposition that you feel like they're most interested in? Is it the clinical impact, financial, operational?
I think it's, operational overall, thinking both clinical and performance in terms of getting things done. So one gentleman that I spoke with yesterday afternoon is somebody who I hadn't met, but he was with an organization that I'm familiar with and know other people in. He came by to see the competition. He was really excited, and he indicated beyond just, he said, well, we can do this for other people than nurses, right? And I said, well, of course. And he started actually riffing and thinking of the possibilities immediately. And then a meeting that I had previously set up with his organization, so it's on the calendar already. I got a message last night that he wants to include 4 other people in that meeting. So this gave direct exposure in a way that validated, because he saw the reactions and the questions from what are you guys calling him yesterday? So was it really that 3 group of the Shark Tank folks?
Our friendly Shark Tank.
So some of their questions, the way the questions presented and the answers also enlightened him too.
Great. Let's pull back a little bit. You've been fortunate enough to have the great experience of working at a healthcare system, and also now as a leader of a startup that's looking to work and partner with healthcare systems. So my question to you is, what role can the American Hospital Association play in, one, better connecting and bridging that gap between the entrepreneurial community and healthcare systems? And then secondly, what role can the American Hospital Association play in accelerating the transformation and disruption at scale, which is the theme of the summit this year?
I'll go with the second question first.
Sure.
And that is the role of the theme is fabulous. No organization in the healthcare industry, no organization has really taken the mantle and moved forward with this particular idea of innovation and productivity in this way to engage how care is provided and delivered, kind of a, operational. How do we do better in the back end, if you will? I don't know if I'm being, clear. But this is kind of a new approach. What do you need that will use more effectively technologies from other industry, approaches from other industry that are appropriately applied here? And as we saw in the meeting yesterday, getting direct feedback from organizations that are using the services, as well as the innovators being people who have been in the industry rather than people who haven't been, whether that's clinicians or people like myself and one of our partners, Jack, who both of us came from hospital organizations working in directing, managing, leading business units, if you will, clinical business units. In fact, both of us we've said for a long time to each other, boy, we wish we had our product when we were running those units. So the AHA now is able to, by taking this mantle and moving forward, it's moving this to the highest levels of the organization. So I think there's been a lot of leaders, but the complexity of the organization, it's now raising it to the level of the highest order in the organization so that the top leaders can become champions. And when they become champions, change is going to happen.
Great. So that was actually going to be my question. You can build on that here is what advice would you give to healthcare system leaders as we think about accelerating transformational change?
It's the idea that there's a lot of things out there and people look toward the C-suite. They look toward the leader of the organization, to say, is this the direction we should go? And by the AHA engaging in this way, it's exposing those leaders to this innovation that's there that they may not have otherwise been exposed to in the same way. Not that the CIOs, not that directors, not that others have been not bringing this forward, but it's making a connection, a strategic connection, and an overall industry connection that is critical, because the AHA is saying we need to do things in a different way, and it's okay, and we need to move that way as an industry. And then the leaders of individual organizations will feel the ability, and not only the interest, but really the ability to do this, because they're not alone. Mm-hmm. We're doing this together. And that's, I think, a glue that the AHA can really bring to the table in these discussions and making people aware.
Chris, congratulations to you and your team at Prescience Health on winning our inaugural startup competition.
We're delighted. Thank you.
Let's switch gears a bit and talk about another session that you attended.
Okay.
Solvathon. Which was a all-day design thinking workshop that the American Hospital Association held for emerging leaders at healthcare systems across the nation. You had a unique perspective as being a leader of a startup working with healthcare systems to sit side by side with some of these emerging leaders. Just starting from the beginning, what did you like? Why did you do that? What did you like about it?
I signed up for that because I'm always looking to learn something new. And Solvathon, what does this mean? I'm not exactly sure, but let's plunge in and take a look. And I got to admit, I got the playbook and I said, did I miss something in the email? Because there's a lot of stuff here, and I'm looking and going, whoa, what are they? Boy, they want us to do a lot in a short period of time. They weren't kidding when they said we'd be busy. But the program, just looking at the playbook, said, okay, let's get going. And it would be a great learning experience. And that's exactly what it was. So it fulfilled my expectation on a broad basis right away.
Great. So what were some of those key learnings?
The process. So I had the fortune of working in an organization, a hospital organization. In the early 90s, they brought in people who had been Baldrige and Deming Award winners, the Qualtech team. And so we put in place total quality management storyboarding. So processes with visualizations and how you work through defined problems and come up with solutions and not skip steps. The 7-step storyboarding process, everybody was frightened of it because of the time that it took and all these things to work through problems or develop new things. And I learned and saw right away, here was a stepped process that started with the customer and in a very specific, focused way, started with the customer, even more than the quality management stuff, of which I've taught as well, and took you through the process. And we were able to come up with something that would be a fabulous start in 8 hours. There was a lot of refinements in this, but even with 2 days, just adding on a second day, slowing down a little bit in a few of the steps, an organization following this process should be able to come up with something, even with some good, solid financials. It's not a long, tedious, drawn-out affair. And so that allows you immediately thought of, wow, this is a great basis to create rapid cycle improvement programs and approaches, because you could put together an approach in say 16 hours and run it out for 100 days and see if it works.
So that's great to hear. So is there something specific that you picked up during your 8 hours doing this that you might implement tomorrow at Prescience Health?
That's a really good question. I have to think about that. I certainly will talk with the partners about, the whole experience. I know I'll put it in this, maybe frame it in this way, because while we're a startup, there's a lot of hospital organizations in department levels, or whether they're innovation teams or whatever. This is a tool they could use, and they could use it tomorrow. If I was running hospital departments, let's see, today's Friday, we would have this plugged in next Monday by noon into at least one project, because we always had various things going on. So this could go from a departmental basis to innovation teams, whatever, and could be plugged in immediately. There's no special language here. There's no, fill in the boxes on the pictured charts and you can create something. So the simplicity of it is fabulous, and it would involve staff members right from the get-go, which is critical. So yeah, that's a takeaway. I was just in awe that this could be taken right out to hospital organizations. And in fact, the various participants in the room Well, I know our particular project, 2 of the people at the table will probably be doing this within a month in their organizations, actually maybe even working toward this actual project that we worked on as a team. But everybody at the table will be using this as part of their toolkit to get things done.
That's great to hear. Last question to bring it all together. What's something that you want hospital and healthcare system leaders to know about the startup community that's trying to better serve that healthcare sector?
That's a heady question. I think so many people that I've met are passionate about caring for people, and they're in this business because people could choose to do a lot of things. But they're involved in startups because, like anything, there's always better ways to do things. They've got areas of expertise and understanding, and they want to apply that to help serve people. Whether, even though it's, say, indirectly, I think they want to serve people. Physicians I saw in the competition yesterday, the business people in the competition, why the folks at Prescience Health have been together for this period of time working on this, because we can apply what we know, and while we're not clinicians in our case, we can help better serve people. Why else would we be doing this? There's other places to do it. It's a fabulous opportunity to contribute while, contribute back and just produce a living,
sure,
if you will, right? That's what anybody in healthcare does. And I think that's what most startups in this industry are trying to achieve as well.
Great to hear. Chris, thank you for your time, and congratulations again on winning the inaugural American Hospital Association Summit Startup Challenge.
Very good. Thank you. We appreciate the opportunity, as I said before.